Hello everyone, and welcome back to the clinical pharmacology and drug therapy channel. We will continue our topic about antibacterial, and our next antibiotic will be chloramphenicol. Okay, speaking about spectrum of chloramphenicol, as you can see here, chloramphenicol considered like broad spectrum antibiotic cover gram-positive, gram-negative anaerobic bacteria and a typical microorganism. Regarding gram-positive bacteria, the chloramphenicol covers streptococcus, staphylococcus, including some type of MRSA, methicillin-resistant staphylococcus aureus, as you can see it here. Speaking about gram-negative bacteria, we have Haemophilus influenza, Neisseria meningitis, Salmonella, and E. coli. All these will be affected by the chloramphenicol. Anaerobic bacteria, we have Bacteroid fragilis, will be affected by the chloramphenicol or treated with the chloramphenicol. A typical microorganism, speaking about two main type of organism that organisms such as Rickettsia and organism that cause typhoid fever. Okay, so the question now, what is the mechanism of action of chloramphenicol? As you can see here, first step here in this chart here, first step, chloramphenicol bind to the 30S. First of all, chloramphenicol bind to the 50S ribosome subunit, and this will lead to the prevent of peptide bond formation, and the end result will be inhibit protein synthesis. So if you compare this one here, this one remind us with similar things with the binding to the 50S subunit. This remind us with the macrolide. So macrolide bind to the 50S subunit. Clindamycin bind to the 50S subunit. So we have the list here. Now we go to the what pharmaceutical forms available from chloramphenicol. We have chloramphenicol oral form like capsule or oral suspension or tablets available for clinical use. We have some injectable forms for IV solution or IM injection from chloramphenicol also. Then we have topical form like ointment or solution or cream from chloramphenicol. We have some eye drops from chloramphenicol. As you can see, chloramphenicol available as oral, parenteral, topical, and eye drops also. So we have so many forms from chloramphenicol. We need to remember the main mechanism of action of chloramphenicol will be binding to the 50S subunit and inhibit protein synthesis. Okay, chloramphenicol, very important issue here. We need to reserve this medication for serious infection. So we don't use chloramphenicol for the treatment of tonsillitis or meningitis or bronchitis. We keep this medication for serious infections because this medication carry the risk of serious side effect. We are going to discuss it later on. This medication able to cross blood-brain barrier, cross placenta, so cross blood-brain barrier, cross placenta. Therefore, we don't use it in pregnancy. In pregnant women, we don't use it. In a pregnant woman, maybe because this medication cross the blood-brain barrier. Therefore, we can use this medication to treat patients suffer from meningitis, for example. They try to remind us also chloramphenicol inhibit microsomal enzyme, and this will increase the possibility of toxicity from phenytoin, warfarin, or tolbutamide. Phenytoin is like a medication for epilepsy, tolbutamide medication for type 2 diabetes, warfarin considered like oral anticoagulant medication. When you use this, one of these medication in patient with infection we treated with chloramphenicol, we expect concentration of this medication to be increased. Example, if the patient take warfarin for the coagulation disorder and come to the clinic suffer from severe infection, and you prescribe chloramphenicol to your patient, the result will be risk of bleeding here because the concentration of warfarin will be increased. What happens with phenytoin? Phenytoin medication used for epilepsy. So if the patient come to the clinic, he has a history of epilepsy and treated with a phenytoin, and you place the patient on chloramphenicol to treat serious infection, the situation will be increased level of phenytoin, and the patient will suffer from severe adverse reaction coming from warfarin, for example. So we have to take the drug history in consideration when you prescribe chloramphenicol to your patient. Patient education is important, one of the important steps when you prescribe medication. Okay, chloramphenicol, as we discussed, wide spectrum, broad spectrum antibiotic, considered like bactericidal for Haemophilus, Neisseria bacteroid, ineffective medication for chlamydia here. So the question, which medication we can use for chlamydia? Someone may say, okay, macrolide, maybe tetracycline. So we have other option here for chlamydia. Regarding to the clinical use, as you can see here, we have limited use of chloramphenicol due to the toxicity. We can use that chloramphenicol for severe salmonella, for pneumococcal or meningococcal resist to the other bacteria, or like unable to respond to the other bacteria. Chloramphenicol, here the key word for us, chloramphenicol cause bone marrow toxicity. Bone marrow toxicity may cause aplastic anemia. For this reason, we don't recommend to use the chloramphenicol. So chloramphenicol may cause aplastic irreversible anemia. Aplastic irreversible anemia. For this reason, we don't recommend to use chloramphenicol due to the risk of aplastic anemia. Chloramphenicol may inhibit bone marrow by dose dependent. For example, if you use large dose, this dose will inhibit the bone marrow and cause anemia also. Using chloramphenicol in baby and children, small children, may cause gray baby syndrome, especially to speak about infants. The situation here, what happened, we have decreased number of blood cells, cyanosis, cardiovascular collapse. This has happened normally in the neonate, especially premature neonate, they who have lack of sufficiency of glucuronotransferase. So what happened here with a neonate, premature neonate, they don't have enough enzyme or enough glucuronase and transferase enzyme that responsible for the metabolism of chloramphenicol. Okay, next medication we have clindamycin, Clindamycin. This mechanism of action is very similar to the erythromycin. The primary use of clindamycin for anaerobic bacteria, Bacteroid fragilis, could be used for the abdominal infections and due to the trauma. Normally we see patients suffer from trauma and they suffer from abdominal infection, and the main bacteria will be anaerobic bacteria, and we treat the patient with the clindamycin in this case. The clindamycin Clindamycin is carry the risk of serious adverse effects such as Pseudomonas colitis caused by Clostridium difficile. This Clostridium difficile will overgrow and producing necrotizing toxin. What happened if the patient starts suffering from Pseudomonas colitis? What is the treatment available for this patient? So if the patient comes to the clinic suffer from adverse effect of clindamycin with the symptoms of abdominal pain, diarrhea, bloody diarrhea, for example, so we can treat the patient with metronidazole or vancomycin. They said the metronidazole the first choice for treatment. The second choice will be vancomycin. Vancomycin should be reserved for the patient who resists metronidazole. Clindamycin, if I click on the link here and share the link with you, maybe we can read some information about clindamycin, Clindamycin. So you see here the clindamycin, you see the brand name and generic name clindamycin. So what the issue here, if you see, first of all, before you read anything, we have 11 pages regarding clindamycin. We have warning. They said the clindamycin may cause Clostridium difficile associated with the diarrhea. So diarrhea, Clostridium difficile. So this is the case here. We have the description how this medication work. Microbiology, I like what we have here. This medication cover the gram-positive anaerobic. You can see it here. We have it Clostridium perfringens. Then we have gram-positive anaerobic. We have anaerobic here. a lot of medication there. So moving to the clinical use indication. Clinical use: clindamycin indicated for treatment of serious infection due to the susceptible strain of Streptococcus, Staphylococcus. We use it for anaerobic bacteria such as bacteroid. If the patient suffers from emphysema, anaerobic pneumonitis, for example, lung abscess, serious skin infection, all these consider like indication to use clindamycin. Okay. Moving to the next medication, next antibiotic, we have Linezolid or Linezolid or Linezolid. This medication, Linezolid, mainly used for the bacteria resistance bacteria such as MRSA, such as FERSA, such as VERE, vancomycin resistant enterococcus. This medication inhibit 70S initiation complex, inhibit protein synthesis. This medication considered like broad spectrum gram negative, gram positive bactericidal effect. Linezolid as completely absorbed. We have it oral, we have Linezolid oral, and then we have Linezolid intravenous, and this expensive antibiotic. So for MRSA, for example, here MRSA. So for this one here, we can use Linezolid or Linezolid. Another option will be vancomycin, for example. Okay, side effect: Linezolid or Linezolid may carry the gastrointestinal upset, nausea, vomiting, headache, rash. All these like consider common side effect. Abdominal pain, nausea, vomiting, diarrhea. But we have some serious side effect coming from Linezolid, such as thrombocytopenia, serotonin syndrome. So two serious effects coming from Linezolid. When you use Linezolid more than 10 days, there is a risk of thrombocytopenia. And when you use Linezolid with other medications such as SSRI and monoamino oxidase, tyramine, the patient may suffer from serotonin syndrome. When you use it for long term, more than 28 days, the patient may suffer from peripheral neuropathy, irreversible, and optic neuritis. So here we have days and we have side effect. If we use it more than 10 days, there is a risk of thrombocytopenia. Thrombocytopenia means decreased number of platelet. Okay, decreased number of platelet when you use it, and the patient may suffer also from serotonin syndrome when combined with the SSRI or monoamino oxidase. If used for long term, like more than 28 days, there is a risk of neuropathy such as peripheral neuropathy or optic neuritis. Okay, the last antibiotic on the list here for the antibiotic and the most common in the clinical practice, we have Quinupristin, Dalfopristin, and the brand name Sinercid. This is a mixture of bactericidal. This is a combination prescribed IV. This medication considered active treatment against the gram-positive cocci, including antibiotic that resist to the MRSA VRE strain. This combination between Quinupristin, Dalfopristin bind to the 50S subunit ribosome, inhibit protein synthesis. We need to remember this medication considered like bactericidal. Bactericidal, here I go back. This medication considered like bactericidal IV administration. Use it for MRSA and VRE, vancomycin resistance, for Enterobacter. Combination of a treatment inhibit protein synthesis. This medication may cause venous irritation, arthralgia, myalgia, hyperalbuminemia, hyperbilirubinemia. This medication inhibits cytochrome enzyme, achieving low level in the cerebral spinal fluid, mainly excreted in feces. VRE stand for the vancomycin resistant Enterococcus faecium. So you see it here, we have it two medications. So the Quinupristin, Dalfopristin, mainly used for patients suffer from infection that resist towards methicillin or vancomycin. Okay, this conclude our antibiotic unit, which consists of several chapters, as you can see from the series of lectures, series of videos. We start speaking about cell wall inhibitor. We cover the beta-lactams. We discuss the vancomycin. Then we move to the protein synthesis. We have aminoglycoside, tetracycline. We have Linezolid, we have Quinupristin, we have macrolide, less of medication. Then we move to the fluoroquinolones, and we discuss the sulfamethoxazole that inhibit bacterial metabolism. This will conclude our unit, our lecture about antibiotic. Long lectures divided in several sessions, around more than 200 slides, but it's mostly covered in some detail that is important for the clinical practice more than basic information. So we try to merge together basic information and the clinical practice, make it apply to the clinical practice, not only to the passing the exam. We need to understand the material, which medication mainly used to treat anaerobic bacteria, which medication mainly used for negative gram bacteria, positive gram bacteria, anaerobic, typical bacteria. So we need to discuss all these details there. We need to remember, for example, side effect of the medication, pregnancy, which medication we can use it safely during pregnancy, for example, which medication is not allowed to use in children less than 8 years, less than 2 months, less than 18 months, 18 years, for example. So we have several approach here for the clinical use of antibiotics. Okay, this will conclude our session for today. Thank you for your watching, and have a great day, everyone.